my name is Amber. I'm going to be your nurse today. How are you feeling, Mom?
I'm good.
Good. All right, today I'm going to be doing a postpartum assessment on you, which means I'm going to be looking at your uterus and your breasts and examining you and your body now that you've delivered your baby. Do you consent to that?
Yes.
Perfect. I'm also doing a general safety check, making sure that there's no IV lines that we're going to be tripping on or fluids running out. The baby's bed, her bassinet is locked, and Mom's bed is also, the wheels are locked, and everything's in place. We're providing patient privacy and washing our hands, and we're putting on our clean gloves. All right, Mom, I'm glad you consent to that. And how are you feeling today, Mom?
I'm good. How are you?
Good. I'm also well. I'm going to have you verify your name and date of birth. After that, I'm going to take your vitals. That's okay?
Sounds good.
All right, Mom, can you verify your name and date of birth for me?
Kathy Bates, 8/15/1970.
Okay. My birthday is August 13th, so we're just 2 days behind.
That's cool.
Yep, Kathy Bates. All right, Miss Kathy. I'm going to go ahead and raise your bed to a good working height, and I have some more questions to ask you. Do you have any dietary restrictions that I need to know about?
No.
Do you have any allergies?
No.
And are you experiencing any pain?
Just a little bit.
Okay, when did that pain start?
Earlier today.
Earlier today, and where's the location of that pain?
On my left chest side.
Okay, on your left chest side. And is there anything that aggravates that pain or makes it worse?
It gets worse when I lay on that side.
Okay, is there anything that makes it feel better?
When I sit up.
Okay, and it lasts for about how long?
About 10 minutes.
It lasts for about 10 minutes. And what is the severity of that pain on a scale of 1 to 10?
4.
It's about a 4. Okay, thank you for letting me know about your pain. And you said you had no allergies, no dietary restrictions, correct?
Correct.
Awesome. We're going to go ahead and take some vitals, and then I have some more questions to ask about your bowel movements and voiding, but I'm going to take your vitals first. And then we can take a look at your chest to see what's going on with that pain. All right. And you and baby are bonding well. Congratulations, by the way.
Thank you.
You have a name picked out?
Yeah.
Oh, good. What's the name?
Tyler.
Tyler, what a great name. Little boy. Aw. All right, I'm going to go ahead and take your vital signs now. All right, your blood pressure is at 120/60. Taking your thermometer out, and your temperature is at 98.7. Taking your pulse oximeter off, and you're at 98.8. So everything's looking good there. Your respirations are at a 12, I counted, and your pulse is at a 66. Your alert and oriented times 4. So all your vitals are looking good here. Before I auscultate your PMI and lung sounds, when was the last time you had a bowel movement?
This morning.
This morning, and everything was normal with your bowel movement? No diarrhea, no pain?
No.
Perfect. And when is the last time you voided?
About 30 minutes ago.
About 30 minutes ago. Perfect. And do you remember the color?
It was kind of a palish yellow.
Okay, good. That means you're hydrated. And was there any pain or foul smell?
No.
No pain, no foul smell. Okay, everything was normal that way then. Good. I'm going to go ahead and auscultate your lung sounds and your PMI for a full minute at the 5th intercostal midclavicular line. So I'm listening for a full minute. All right. And I'm going to go ahead and raise you to a high Fowler's position for your lung sounds. Is this comfortable, Mom?
Yes, that's fine.
Perfect. I'm going to go ahead and listen. All right. Take a deep breath in and out, 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 in and out. We're just going to go back up to this PMI and listen for another full minute at the mid-clavicular 5th intercostal space. S1 and S2 are noted, and the rate and rhythm is normal as well. We're going to sit you up and listen to your posterior lung sounds. And I'm also going to just support you with this hand. Okay, take a deep breath in and out. Deep breath in and out. Take a deep breath in and out. Deep breath in and out. deep breath in and out, deep breath in and out. All right, Mom, we can sit you back down. Also, while I'm here, I'm just gonna listen to your bowel sounds, starting with the right lower quadrant. Okay, bowel sounds are noted. It's also noted that there were no adventitious lung sounds. There was no cracking or wheezing in your lungs, so that's good. So listening to the right lower quadrant, there are active bowel sounds. Right upper quadrant, there are active bowel sounds. Left upper quadrant, active bowel sounds, and left lower quadrant, there are also active bowel sounds. Okay. And at this point, now that we've auscultated your bowel, heart, and lung sounds, I'm gonna go ahead and palpate and examine your breast. Are you okay with that, Mom?
That's fine.
Okay, perfect. So taking a look at your right breast, it looks like you're a little engorged because your breast is firm. It looks like there's no discoloration on your nipple other than a darker areola, which is normal post-childbirth. And looking at your left breast, you're also engorged and firm, but your nipple is cracked. It is red, and I can see that would cause some tenderness. How's baby's latch, Mom?
I think it's okay.
You think it's okay? After assessment, I'll make sure to come in and evaluate how your baby's latching, because that could be the cause of the pain, and we'll get you some nipple cream for that also. Alrighty, I'm gonna go ahead and evaluate your fundus, uterus, bladder at this point. Alrighty, so I'm just taking a look at your fundus here. And your bladder is not distended because you just voided. Your fundus is not boggy. Your uterus is firm. And it's about 2 finger breaths away from the umbilicus, which puts you at U-2 for your uterus. Alrighty. At this point, I'm going to take a look at your pad and just see how your lochia is also. Mom, when is the last time you changed your pad?
About 15 or so minutes before you got here.
Okay, and was your bladder full of blood, or was it not super bloody?
Not bloody, really. It was about an inch, maybe.
Okay, and was there any foul smell?
No.
No? Alright, so I'm going to go ahead and examine the lochia now. So I'm examining the lochia on Mom's pad, and it is scant, which means it's about an inch wide. There is no foul or aggressive smell, and the color is rubra. I'm going to go ahead and take off my gloves, wash my hands, and put on clean gloves to roll Mom over. So we're rolling Mom. Alright, Mom, I'm taking a look to see how you're doing in your perineum area. Alright, so I'm taking a look at Mom. I'm spreading her buttocks, and I'm checking for any hemorrhoids. Mom does have a hemorrhoid. She also has a 1st-degree laceration in her perineum area, so we will get some witch hazel for that. And Mom, you're not experiencing any pain down here, are you?
No.
No pain? Alright, and there's no foul smell, there's no abnormal redness, bruising, or swelling down here as well. So we're going to flip Mom over. We're going to take off our gloves and wash our hands again now that we've just checked her hemorrhoids. Alright, gloves back on. It's also noted that if Mom's uterus was exposed and she had a C-section, I would evaluate for RETA, which would be redness, ecchymosis, edema, discharge, and approximation. We would look at the condition of her wound and the dressing of the wound covering. Alright, so now that we've taken a look at your uterus and your fundus and your bladder, I'm going to go ahead and evaluate you for Hohenstein because you are low DVT risk. Alright, we're looking for any pedal or tibial edema. So Mom, I'm just lifting your leg and I'm dorsiflexing your foot quickly. Mom, are you experiencing any pain now?
No.
No pain? Alright, and there's no abnormal temperature, warmth, or edema, any coloring that I'm concerned about. So we're looking good that way. I'm going to check your other leg for Hohenstein since you're low DVT risk. This just helps with any clotting that might happen. So I'm lifting your leg again, quickly dorsiflexing the foot back. Mom, are you experiencing any pain?
No.
Alright, perfect. We can put your foot down. Cover you back up. Now I just have some questions to ask you. So, Mom, you and your baby are bonding well, you said, right?
Yeah.
And how are you feeling emotionally? Are you in good spirits?
Yeah, I'm just super excited to bring my bundle of joy home and into this world.
Yeah, baby Tyler, you're so blessed, Mom. Well, I'm really glad that you are not experiencing any baby blues or postpartum depression and that you're in good spirits. So we're gonna go ahead and lower your bed now. I also want to note that if Mom had a Foley catheter, that we would evaluate how many milliliters was in the catheter. We would do intake and output evaluation as the Foley catheter began to fill, but Mom does not have a Foley catheter. And she did note that there was no abnormal color, pain, or anything like that with her voiding. So I'm glad to hear that you're doing well, Mom. We're just lowering your bed to a very safe height for you, the lowest setting. And Mom, did you want to lay back down?
This is fine.
This is fine? Perfect. So I'm gonna go ahead and take my gloves off now that we're done with our assessment. Wash my hands, do another safety check, no IV lines, bed is locked. Here's my call light if you need anything. Can I get you water?
No thanks.
Alright, well my name's Amber. If you need anything, I'll be back in just a little bit to look at how baby's latching. Okay, Mom?
Okie doke.
Alright, be back soon.